So first of all, thank you for participating here in this very nice conference. This is a joint work with Marília Nepomuceno from Max Planck Institute for Demographic Research and a team of colleagues from the Health Secretariat from the state of Paraná. And we wanted to explore the changing age structure of coronavirus SARS-CoV-2 deaths and cases. And we are relying on a case study from Paraná, Brazil, which is the state I'm talking now from. This is just to tease you on came on The Economist yesterday, why rich countries are unable to deal with COVID-19. And one of the big answers to that is how COVID-19 is related with old age. So here is the course of the old age. For Brazil and for other developing countries, myself and other researchers, we worked we really knew that COVID-19 was really related with gender, or with age, I'm sorry, so that aging population would be more exposed to the virus. But on the other hand, we were very concerned about how people that interact with elderly, such as adults, young adults that live together, how this could relate to a development of the disease totally different from the developed countries. So we wanted to study that. We wanted to see some specificities, and we worked with the state of Paraná in Brazil that provided us data by age, sex, and gender. Why we chose Paraná? Because first we had data, also because Paraná it has an older age structure than the rest of Brazil. It has a lower fertility rate and higher life expectancy. Also, it's one of the most developed states in the country. The Human Development Index, for example, is 0.749. The current state of the pandemic, the first case of COVID-19 was documented on March 12, 2022, this year. As of July 27, this data that I'm presenting here, this paper is referring to July 27. We had 60,008 cases and 1,000 deaths, a death coefficient of, I'm sorry, I can see here, 0.05. Brazil, it's 42 per 1,000 inhabitants, and a fatality rate of 2.5%. In Brazil, 3.6%. And also, as in other parts of the country, we suffered of limited testing. This is some recent data for the cases followed by epidemiological week. And we could see in Brazil, it's starting, it has been discussed in the literature and also in the media, that we are starting a second wave without finishing the first one. So this is really challenging for the country. Since the beginning of the epidemic, measures haven't been taken to prevent the COVID-19 spread in state of Paraná, for example, in February, but never a lockdown. For example, they suspended public events, teleworking, they suspended classes in public and private universities, but really the lockdown measures were not enforced. So given these demographic features of Paraná state and administrative microdata that we were able to collect by gender, sex, and age, our goal was to explore the demographic evolution of COVID-19 deaths and cases in the state. Our hypothesis following our previous work was that loose restrictions of social isolation would increase the levels of inequality compared with the more developed countries. I mean, so if you compare Brazil's case to Europa's case, in Brazil would have young adults that cohabitated, that contribute to the community transmission of COVID-19, which would then imply to a young age structure of the cases and deaths. So why this is relevant? Why should we talk about it? Because we have to talk about young people. Given the role of asymptomatic and pre-symptomatic transmission, the strict adherence to community mitigation strategy and personal preventive behaviors by younger adults, we think it's key to reduce the risk of infection and subsequent transmission of COVID for persons with high risk of severe illness. Some methods we use administrative records from the Paraná Health Secretariat. We monitor cases and COVID confirmed deaths by single age, sex, and municipality of residence. That's why we tried to initiate a very preliminary spatial analysis. The municipalities were classified in low, medium, and high as the percentage of the elderly, and low, medium, high as per the number of COVID cases. Our results show that COVID cases and deaths in the state of Paraná endorse the rejuvenation hypothesis when the pandemics unfold in the state. Cases are more concentrated among individuals in the economically active groups, prime ages, unlike in the beginning of the pandemic, which was concentrated among old people. The initial age-sex distribution was more concentrated amongst 50s, 60s, and above. As the pandemic unfolds, there is a clear rejuvenation of the age structure of deaths. And that's why in developing countries, this deserves attention. So here we have some pyramids, age-sex distributions of the cases and deaths according to the weeks of the evolution of the disease. And then we can see that with the time, it starts to be more rejuvenated, both for the cases and both for the deaths. Cases are in the left side and deaths are in the right side. And here, finally, when you compile all the weeks, we know that the case structure is totally different from the deaths structure, which is more aged, of course, but in the beginning of the pandemics, it's really more aged than in the very end, when people start losing the restrictions of and spreading the disease. Here I just calculated some average age of the cases, how it decreases with the evolution of the week from 47.15 to 40.41. And while the age at death remains basically constant, here the scale is very, it's large, but it's remained about 68 years. So we also wanted to explore in this space the demographic aging process of the COVID and the relationship with the age distribution of the cases. So what we see is the low municipalities, which are the blue. Low means low percentage of elderly, low number of cases. They decrease. The rejuvenation process can see from the medium-low municipalities that the green, that it starts to increase. The number of green, the blue decreases and the number of green increases with time. And also there is the same relationship with the age distribution of the dead. It turns out that the number of municipalities that have high number of deaths increases systematically over the weeks. The number of municipalities, the lower percentage of elderly and lower number of registered deaths decreases. That means there has been a rejuvenation process, which is can to be seen in the number of high increases. So conclusions, our results demonstrate that with the evolution of the pandemic, a small take-up of the measures of social isolation by the population, the age distribution of deaths and cases has rejuvenated over time. As a future research agenda, besides the age structure, we will incorporate the structure of morbidity in each stage, as claimed as being an important feature for comparison. I had something here that other concludes that the increased prevalence of SARS-CoV infection among young adults likely contributes to the community transmission, and that's why it's important to focus also on younger adults. And the emphasis, of course, should be placed on target mitigation strategies to reduce infections and transmission among younger adults, including age-appropriate prevention measures, such as restricting in-person gatherings and events, recommending mask use and social distance, implementing safe practice on site eating and drinking venues, enforcing protection measures. Not all of these measures have been enforced by Brazilian government. And that's the reference, and I thank you for your attention.